Despite the well-known rap artist A$AP Rocky's views regarding LSD being a recreational Hollywood drug, it actually has more uses than just recreational purposes. As a college student, I have come across people firsthand who have said they've tried LSD for recreational use and have since reaped its mental health benefits. First synthesized in 1938 by Albert Hofmann, the components of LSD were said to stop gynecological bleeding, induce uterine contractions, and eliminate migraine headaches. As a result, LSD was sent immediately to the lab to be pharmacologically tested, and after animal testing, it was decided there would be no further testing. A few years later, in a freak accident, Hoffman was synthesizing a new example, and he ended up trying LSD himself. Now in modern use, LSD has been used traditionally for recreational purposes to get a psychedelic high, though over the course of time, LSD has also been used for mental health purposes. LSD has been in therapy to help people discover themselves, promote happiness, and eliminate other addictions or dependencies. By 1965, there are already thousands of cases done in which LSD had been tested for medical reasons. One of the most common ways it's used is to get information about oneself, a sort of journey of self-discovery, if you will. A mental health specialist would give a patient a microdose of LSD, which is about 20 to 35 milligrams, and a regular dose is about 100 to 125. In some cases, regarding patients who were struggling to open up or were having problems remembering events, psychoanalysis done on these patients on the microdose of LSD were said to have heightened suggestibility and facilitate recall, association, and emergence of unconscious material. So what does all that mean? It means they were able to recall moments more clearly and remember things that were stored in their subconscious that they couldn't reach normally. In doing this, a mental health specialist could better treat their patient because of the fact that they better understood what was going on inside their patient's mind, and the patient was more apt to cooperate. Another way mental health specialists have used LSD in therapy was in their patients who were severely depressed. LSD promises its users a strong sense of insight and self-understanding. In these patients who were depressed, in the post-evaluation after the trip, most had admitted that at some point they'd experienced a significant amount of self-growth. Abraham Lincoln had once said, "A man is just as happy as his mind is made up to be," and patients who were struggling emotionally after trying LSD said that their mood that was on LSD changed after the experience too. In an experiment with patients who were struggling with cancer, they were given a dose and were allowed to trip in a hospital room that was designed to look like a living room. Fast forward 6 months, and all the patients said that the same sense of reduced anxiety that they had felt after the trip, they were still experiencing. In addition, medical uses of LSD has proven to counteract addictions and dependencies. Hundreds of tests were done on all sorts of people who were experiencing all sorts of addictions, things from chemical abusers like heroin addicts to people who smoke cigarettes regularly, and even to people who are alcoholics. A study was done in 2014, coupled with therapy, on a group of people who smoked about a pack of cigarettes a day for 31 years. After 6 months, about 80% of the group were cigarette-free completely. Another study, done by Terry Krebs on a group of alcoholics, said that of those who had taken LSD, 59% had reduced their consumption of alcohol, while those who did not take LSD, only 38% reduced their consumption of alcohol. This is because, while on LSD, your brain is relaxed of its normal habitual thinking, and normal habits like smoking a cigarette suddenly become foreign habits. So you're probably thinking to yourself, so why does LSD work? Why does it do the things that it does? Why does it fix these things? If somebody takes LSD, there's a decrease in that person's blood flow, as well as a decrease in activity in that person's default mode network, which is located in the prefrontal area of someone's brain. Okay, well, what does that mean? That means that part of your brain is responsible for your ego and sense of self. Whenever you daydream or think about something really hard, it lights up like it would if you were on a drug such as LSD. So when someone is on LSD, they get detached from things like their egos. This, in turn, leads to promising results in self-discovery, depression and anxiety issues, as well as addictions and other chemical or physical dependencies. So no, while I am not condoning you to go out and drop acid, there are in fact mental health benefits that can be reaped from LSD in a professional setting, and I do agree with those practices only under those circumstances.